Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart, Life as a Dad and a 35-year cancer survivor. Available on Amazon, before I forget. I want to continue on with my series on cancer survivorship, building your long care team. And of course, I'm talking about that time period after 5 years of following up for your cancer remission, and your oncologist says, we don't need to see you anymore because your cancer we don't feel is going to come back. And the need to follow up with your primary care doctor, as I mentioned in the first video of this series, to follow up for any potential late side effects. In this video, I want to talk about endocrinology. Now, endocrinology, I'm not going to get too sciencey on you. That basically deals with your glands and organs, which are responsible for producing and releasing hormones. We're talking about regulating bodily functions like your metabolism, your growth, reproduction. You've heard of these body organs in school, if you remember that: pituitary, hypothalamus, thyroid, adrenal, pancreas glands. I'm going to talk about two of the issues that I deal with as a result of my long-term survivorship in regard to my thyroid and, unfortunately, diabetes. I was exposed to radiation therapy, and it's possible that some chemotherapy are playing a role in this as well. But basically, what the radiation has done to my thyroid, from what it is described, it's all shrunken and misshaped. And I also do have several nodules that appear on that thyroid. I've had one of those nodules actually biopsied for the potential for cancer. It's not uncommon for the thyroid to get removed when when the nodules become problematic. As far as the diabetes is concerned, of course, diabetes is tied to the pancreas. The pancreas is one body organ I have not subjected myself to any kind of testing related to my treatments. However, I have something that is called insulin resistant diabetes. And basically, what that means is that instead of my liver working the way it should, the pancreas actually has to work harder to make the insulin. So I'm going to get into the blood sugar thing in just a second. But also where chemotherapy can play a role in impacting the endocrine system. It's very common for cancer patients, female cancer patients, to go through what's called early menopause. And it can be quite distressful, especially for younger women going through this who had other ideas along, way in the future that, you get sidetracked with. Now, the way they measure diabetes is something called blood sugar testing. Usually involves finger sticks if you are a full-blown diabetic. One of the few times that I actually give my doctor a hard time, I'm a needle phobe. So I have been completely resistant to checking my blood sugar. I know what causes my blood sugar to go up. It's purely diet motivated. So I am a stress eater, and that's likely where I'm liable to fall. When I have appointments coming up, like I'm doing right now, I'm more aware of things, and I do a lot better at controlling what I eat. Some would say that's cheating, and it is, because I'm giving up the things that I enjoy eating. I'm a very picky eater, so I've got real bad diet habits. But for the longest time, I've never been a diabetic until a few years ago. So that's why I'm inclined to want to blame the pancreas, but I've got enough going on with me that I don't need to add anything else more to it. So besides blood sugar testing, if you are someone like me who tries to skirt the numbers, in other words, they check your blood at the lab or at the doctor's office, and you want to produce low enough numbers, they have a way of finding out if you've been cheating. You quit the candy, you quit the soda for a week before so that you get your blood sugar numbers down. They have something called an A1C. And basically, that's testing for hemoglobin. And what this is, and it was funny because my primary care doctor blew the whistle on me for it, because she praised me for having my blood sugar quite well. But she says, I know you're not doing the right things though. This A1C tests your blood sugar for an average, an average. So you already know where this is going over a time period of 2 to 3 months. So they're looking at your blood sugar over the last 2, 3 months, and that is what you're going to get lectured about most by your doctor, that result. So I was warned that the number you want to have an A1C below 5.7, which mine was around 5.9. So I was in what was considered the pre diabetic range. Fast forward, I eventually ended up as high as 9, which is completely diabetic. I am on medication for it. I do exercise. I have lost some weight, which has produced a reduction in that A1C number. I'm down below 7 finally. I will be getting this blood test done again in a month. I expect to have better results with that as well. And I'm going to continue to do what I do. I also undergo scans and ultrasounds for my thyroid. It does show the nodules and everything else like that, but nothing has shown any further kind of action necessary yet. And again, I mentioned I'm not doing anything with my pancreas. So, one of the things, because of being diabetic, they throw something else at you, caring for your eyes. And I'm going to produce a separate video for ophthalmology because it does turn out that while I do have a condition related to the diabetes, if that's connected to my long-term survivorship, which I do believe it is, there is another condition that was diagnosed with my eyes, affecting my vision somewhat rapidly, that the ophthalmologist just even took a stab at it and guessed that I was taking a certain medication during my chemotherapy, and that has caused some damage to my eyes as well. I'll get into that on a separate video though. I wanted to concentrate on the focus on endocrinology. So yes, that means make an endocrinologist part of your long-term survivor team. If you've had radiation or if you've had a certain chemotherapeutic drug that may have affected your glands, especially when it comes to reproduction, and if you are finding yourself dealing with menopause earlier than expected. So until next time, this is Paul's Heart.